Hi friends, I am Dr. Saurabh Chaudhary and I am a neuropsychiatrist. In today's video, I am going to discuss the frontal release signs. So I will discuss what are various frontal release signs and I will also discuss the conditions where these frontal release signs can be seen. So in an infant, there are certain primitive reflexes which are seen. These are called as the frontal release signs. But as the brain maturation happens, these primitive reflexes are lost and this is a normal phenomena. But due to certain neurodegenerative conditions such as after the cerebrovascular accident, that is a stroke, or after certain metabolic disorders called as metabolic encephalopathies, or due to neurodegenerative conditions such as the dementia, there could be reappearance of these primitive reflexes. So now I am going to discuss various frontal release signs. First is the grasp reflex. When we touch the palmar aspect of the person, there is grasp reflex. Uh, there is context. There is a grasping movement of the palm. This is called as the grasp reflex. Second comes the palmomental reflex. When we squeeze at the thinner eminence of the person, there is twitching movement at the chin. This is called as the palmomental reflex. Now comes the sucking and rooting reflex. So when we touch over the cheek or in the area surrounding the lips, there is deviation of the angle of the mouth towards the touch, and there is sucking movement. This is called these are called as this rooting and the sucking reflexes. Now comes the pouting and the snouting reflex. When we tap over the lip area of the person, there is puckering movement of the lips. This is called as the pouting or snouting reflex. And next frontal release sign is the glabellar tap. So when we normally tap in the area between the eyebrows, there is usually one or two blink, and after which there is no blinking even after the repeated tapping in a normal person. But in a person with the frontal release sign positive, there is repeated blinking movements over the repeated tapping. So these are some of the frontal release signs commonly seen. Thank you so much.